In research, having good data is invaluable toward gaining better information.
What it really involves is how do we collect data, how do we plan and prepare and collect good data, the whole process of managing the data, all the way through the analysis of data.
And gaining better information from data is the key to increasing medical knowledge.
The conventional view is that data get converted to information and then information gets converted to knowledge. I tend to think of data and knowledge as two types of information, and we're working on converting the data into knowledge.
Discover the Data Science Institute, converting data into knowledge, inside this edition of CTSI Discovery Radio. Welcome to CTSI Discovery Radio. I'm your host, Brian Belmer. CTSI Discovery Radio is brought to you by the Clinical and Translational Science Institute of Southeast Wisconsin. The CTSI is a consortium of researchers, doctors, scientists, and others representing 8 institutions, including the Medical College of Wisconsin, Milwaukee School of Engineering, Marquette University, the University of Wisconsin, Milwaukee, Children's Wisconsin, Froedtert Hospital, Versity Blood Center of Wisconsin, and the Zablocki VA Medical Center. The CTSI works collaboratively across all of our member institutions. Our mission is advancing health through research and discovery. It's said you can have data without information, but you cannot have information without data. Furthermore, you cannot have knowledge without information. To help advance medical knowledge through research and discovery, data scientists play an essential role. But what is data science? For that matter, what exactly is data? Let's find out. From Dr. William Hogan, Professor and Mary T. and Ted D. Kellner Chair of Data Science, Director of the Data Science Institute, and Associate Director for Data Science in the Mellows Center for Genomic and Precision Medicine at the Medical College of Wisconsin. As a starting point, it's important to first understand a couple of key definitions in the context of medical research. First, data. What exactly is data?
Data, at their essence, are just a record of the state of the world at the time the data were made.
For example, in a research study comparing 2 medications, data might include
who were the participants, how old were they when they were enrolled, how old were they at their first study visit, what study intervention did they get, what other medications were they on at the time. So it's just a record of how things were accumulated for a particular purpose.
Or, in the case of a patient's electronic health record, data might include
what was the patient feeling that day, what symptoms did they have, what conditions or diseases did they have, what drugs were they on, what drugs were they prescribed during the visit, and so on. So electronic health record data are a big one, and a big one I focused a lot of my career on.
And Dr. Hogan says there are more data that are vital for advancing research.
What encounters patients have had, visits to the clinic, hospital stays, visits to the emergency room, prescriptions, what diseases or conditions a patient has, what procedures were done, what laboratory tests done, vital signs, imaging, MRIs, CAT scans, chest x-rays. And then in medical research, we reuse a lot of the healthcare system data collected, and so there's just like a rich universe of data used in medical research and healthcare.
Okay. So what then is data science?
What it really involves is the entire life cycle of those data. So how do we collect data? How do we plan and prepare and collect good data? The whole process of managing the data, all the way through the analysis of data. You know, a lot of times data science gets equated with just that last part, analyzing the data through anything from traditional biostatistics to machine learning, advanced artificial intelligence.
Although there's no denying the importance of analysis in data science, because that's where data scientists are
turning data into knowledge, right? And that's why we're collecting the data and doing the research. And turning data into knowledge is very important, especially today with the advances in AI. But it's really that whole life cycle of data, and we really study and create new methods for data analysis, but also that whole process and life cycle of collecting data all the way through to publishing the data, making it available, and reusing data, and so on.
One final definition: informatics. What exactly are informatics?
You could say it's the science of information. Well, then what's the difference between data and information? The conventional view is that data get converted to information and then information gets converted to knowledge. I tend to think of data and knowledge as two types of information, and we're working on converting the data into knowledge. So informatics, again, it's the study and application of information in the context of medical research and healthcare.
And he adds this distinction.
A lot of times, data science is viewed more broadly than informatics to include the full universe of biostatistics and what it historically and traditionally has done and increasingly is doing, and the boundaries are blurring. The overlap is increasing between informatics and biostatistics, and so data science is kind of an umbrella term to encompass both informatics and biostatistics.
Next, Dr. Hogan shares insights on the Data Science Institute at the Medical College of Wisconsin, beginning with its overarching mission.
Our mission is to meet the data science needs of our researchers and our healthcare partners. So in that sense, data science is a science in service of science, but it's also in the service of clinical healthcare practice. But, our researchers need data scientists as collaborators to do things like genomics data analysis, to do imaging data analysis.
Which means that
increasingly, as we get newer and more innovative types of data, as we get larger data sets, as we get more sophisticated and nuanced data sets, data science is increasingly relevant to the research mission. And then, of course, all these types of data move from the research side to the healthcare practice side. And so they need data science help managing those data and working with those data.
What are the main goals of the Data Science Institute? Dr. Hogan says they can be summed up in 3 areas. First, research.
There's 2 aspects to research. One is our researchers need data scientists as collaborators to be able to do their research, but also we are developing new methods to manage and analyze and handle these data. The science of data science advances as new kinds of data come along, and then our response is to create innovations, new methods for analyzing those data.
Second, the Data Science Institute has goals related to vocation.
We need to train the next generation of data scientists, and that's very important. We do have workforce shortages, especially on the faculty side, but also we hire data scientists to help us do our work, and there are workforce shortages in both cases.
He adds the Data Science Institute aims
to educate our collaborators and leaders, healthcare partners in basics of data science. There's been a lot of demand for data literacy. There'll be better researchers, better doctors, better healthcare providers, and so on if they know more and can do more. So there's a lot of data literacy education that we have in our plans to develop.
And third, goals related to people.
Ultimately, we want to see healthier people. We also have a vision for improving the data literacy of our communities. And so as we do advance new research findings and translate those research findings into care, the vision is we have healthier people in the state and can empower these people to better understand their health through data and things like that.
What specific health system partners does the Data Science Institute collaborate with and bring innovation to?
The key healthcare partners are Freighter, Data Care Health, Children's Wisconsin and the Veterans Administration. We work with them in different ways. Their electronic health record data is a very valuable research resource, and so they have been very generous in working with us to share electronic health record data in a very secure way in compliance with all privacy regulations and overseen by institutional review boards.
Then, the Data Science Institute provides vital knowledge, such as artificial intelligence models, back to these health system partners.
I and others sit on health system committees to review AI models that are proposed for implementation in the healthcare system. Some are more administrative efficiency models, like more efficient OR scheduling, and some are more clinically focused models. How do we predict that a patient's going into sepsis, so the earlier we intervene in that situation, the more likely we can resolve the sepsis safely and protect health and life of the patient.
He shares some specific ways they help their healthcare partners.
We help them review those models by various criteria in terms of, were they generated using good data? Were they generated using proper techniques and statistical methods? Are there any biases in the model? Was the training data set sufficiently broad? A lot of times models trained at just one institution don't function well when you try to use them at another institution. So were the models trained at multiple institutions, so they're less likely to have issues?
What's the origin of the Data Science Institute at MCW? Dr. Hogan takes us back just prior to the COVID-19 pandemic, when
a group of faculty decided that the Medical College of Wisconsin needed data science expertise, and they needed a unit within the medical college to be the central focus of data science, to grow it, to meet the needs of MCW and the healthcare partners. And so they approached the dean. The dean said, okay, well, I'll establish a data science working group, and you go off and study this problem and come back with recommendations.
What were that group's recommendations?
They came up with a report, and they recommended that it should be an institute because you need the data scientist faculty to have an academic home. You also need a center-like function, and here an institute's a department plus a center. So you need the service aspect of it and the collaboration aspect of it. So they recommended it be an institute.
And they needed the right person to lead and guide an institute. That person is Dr. William Hogan.
As we emerged from the pandemic, they moved forward with recruiting the inaugural director of the Data Science Institute. I was privileged and fortunate to be selected. And so I started in August of 2023, so I've been here a little over 2 years to establish the Data Science Institute.
But even in the relatively short amount of time since its inception, the Data Science Institute is making an indelible impression.
Given the widespread, broad interest and needs in data science, it was really important to be strategic. So I needed to focus on the most critical priorities. And so I created a strategic planning committee, and we created the strategic plan for the Data Science Institute.
And that strategic plan has produced several highlights to date.
One is for the faculty home. I've recruited a number of faculty in data science, both to the institute itself, but also clinical faculty. For a physician, for example, who does a lot of data science work, then there's a partnership between the institute and the clinical department to bring an advanced person here who's a physician scientist, where the science they do is a lot of data science.
A second highlight has been
to convene the data science community across the medical college, our health system partners, and other universities. Marquette University, Milwaukee School of Engineering, University of Wisconsin at Milwaukee. We've been holding what we call the CWINS, Southeast Wisconsin Data Science Symposium conferences. We held our first one in 24, and now we're ready to hold our second one this year.
And a third highlight,
the emergence of these really large, rich data sets that can be used for research, and they can be used for multiple kinds of research, so they're kind of disease agnostic. And so this data set is very big. Researchers, though, they need help getting access to that resource, understanding the data, working with the data, analyzing the data. And to do that on your own and get all that understanding on your own is very difficult.
So, the Data Science Institute created something called
research accelerator designed to lower the barrier to entry to data sets. So being a source of sharing software, sharing insights into the data, sharing documentation, sharing templates for getting IRB approval can really energize and spark an explosion in research on these kinds of data. So the research accelerator is underway.
It's all being done by the excellent team he assembled,
I have a phenomenal team, very proud of and excited to work with.
including key faculty members.
I've recruited faculty to the Data Science Institute. For example, one faculty I recruited is Dr. Wasay Khan with the Center for International Blood and Marrow Transplant Research. It's a longstanding and prominent, nationally preeminent research center here. So this faculty member was a joint recruit. They have huge data science needs. So it's right in the wheelhouse of the mission of the Data Science Institute.
And the Institute's growing.
One of the big developments since I started was, as of last year, the Division of Biostatistics is now in the Data Science Institute, and that has worked out extremely well and has really energized the division, energized the Data Science Institute, raised the profile of the Data Science Institute, and we're seeing the fruits of that move already.
In general, what makes the Data Science Institute such a vital part of the research enterprise at MCW and beyond?
It's because the importance of data has really grown. The criticality of data science has grown. The volume of data has grown. The types of data have grown. Genomics data has really burst onto the scene in the last couple decades. Imaging data, new types of imaging being developed, and you need data science experts in imaging data to handle those.
And that growth increases the need for data science and data scientists.
Data scientists in our development of methods to handle those data are just more and more important all the time. The new artificial intelligence models, people need help understanding those. Setting one up to run patient data in a secure and private way is not something that a non-expert can manage. They need data scientists to help with that. So it's just increasingly critical that data science is at the table and working with researchers in the healthcare systems to advance the science and practice of healthcare.
Making data scientists primary players in transforming healthcare and biomedical research.
Absolutely. Just during my career, academic homes for data science have doubled in number, if not more. And prior to Medical College of Wisconsin, I established academic homes in biomedical informatics and data science, and just increasingly important and critical to the advancement of society.
To the extent that the importance of data science cannot be overstated.
It's increasingly integral to the functioning and advancement of the economy, of society, to our general collective well-being. And the Data Science Institute, we're doing those things specific to biomedical research and healthcare in Wisconsin.
Next, we asked Dr. William Hogan to share some additional examples of ways that the Data Science Institute is contributing to the overall research landscape at the Medical College of Wisconsin, and he happily obliged.
Having the Data Science Institute here is just such a reassurance to faculty recruits. It helps bring faculty in, especially faculty that have a major data science component to their work.
He details how the Data Science Institute has contributed to faculty recruitment and growth across the college.
I helped recruit 2 faculty to our biophysics department who do a lot of computational modeling of the dynamics of molecules and proteins and how they fold. And a lot of proteins are enzymes, so how do the enzymes interact with their substrates to facilitate the chemical reactions?
On the clinical side,
I have helped recruit clinical faculty like Dr. Nick Simonkovich. He's doing work with liquid biopsies. DNA from our cells is free-floating in our bloodstream. You can capture that DNA, sequence it, figure out what types of cells it most likely came from, and then analyze that in the context of health and in various disease states, and then figure out ways to diagnose disease, predict disease course and future severity, and so on.
On the precision medicine and genomics front,
I helped recruit Dr. Iftikhar Kulo, who's doing a lot of work in precision medicine, looking at precision medicine and the genomics of lipid disorders. And then we have Dr. Xiaowu Gai, who was recruited joint between the Children's Research Institute and our Mellows Genomics Center, who does what we call bioinformatics. So underneath informatics, we have sub-areas of informatics. The bioinformatics, really, they're focused at the molecular genomics side of things.
Looking forward, what are the significant initiatives planned for the Data Science Institute in the coming years?
One big one is the Clinical and Translational Science Award. The National Institutes of Health created the program to speed up the rate at which we turn basic science findings into treatments, prevention, and prophylactic therapies that help patients and are used regularly in the healthcare system. That process, we call it translation, because you're translating basic findings into practice.
It's this NIH grant that funds the CTSI to further that process.
The Medical College of Wisconsin has had a Clinical and Translational Science Award. We got our first one in 2010, and you then apply to get your subsequent awards.
And for its next grant cycle, Dr. Hogan joined CTSI as co-principal investigator as part of the grant application process.
I recently accepted an invitation to be what's called a multiple principal investigator on our next CTSA grant submission in the coming months. And that just speaks to how essential data science is. So the CTSA program has always had a requirement for an informatics and data science core. They just changed the name officially to data science a year ago. Data science is right at the heart of it, and so it makes sense for me to be one of the key leaders. Now, as a multiple PI, I'm not the lead. We have a contact PI, Dr. Julie Freed at the Medical College.
As far as collaboration, the Data Science Institute collaborates with many of the same partner institutions as the CTSI.
Precisely because of the importance of data science to the Clinical and Translational Science Institute. So, I've partnered with UW-Milwaukee, Milwaukee School of Engineering, and Marquette University.
What are some of the highlights of the Data Science Institute's partnerships with these other institutions?
We are working on initiatives to elevate AI education in the region and how we can do that synergistically instead of competitively. We're looking at shared research opportunities, collaborations. Where do we complement each other? Data science is a big field. We've got lots of subfields, so we have some expertise here that the other universities don't have, and they have expertise we don't have. And so if we can bring experts together, we can approach opportunities that otherwise we wouldn't be able to get on our own.
One collaboration is the Southeast Wisconsin Data Science Research Symposium he mentioned earlier.
The CWIN Symposium is Friday, October 24th. It's going to be at the Milwaukee School of Engineering. We have a keynote speaker, Nigel Nelson of NVIDIA. The theme is AI transforming translational science. We hope to have a lot of content on the latest and greatest that people are doing in AI to transform research and healthcare. So we're very excited about it.
And this year's symposium promises to be bigger than last year's inaugural event.
Our first CWIN Symposium, we had over 150 attendees. We're expecting this one will be even bigger.
In addition to launching and leading the Data Science Institute, is Dr. Hogan himself involved in research of his own?
Absolutely. My area of expertise is called ontology with a T, not oncology with a C. And ontology, that term derives actually from philosophy. In philosophy, ontology is the science of what exists and the nature of what exists. And the reason that's important for data science is that data represent what exists. Data are a record of how the world was at a particular time in the past.
Ontology focuses on the importance of standardizing data. because
we need to standardize our data so that we can integrate data sets across institutions, across the country, and build bigger data sets that we can do more with. And so ontology is really just a data standard that provides standard codes for things like diseases. So we have a standard code for type 2 diabetes that we record in the data, and then if everybody uses that same code, we can merge our data sets and advance research even further.
the ontology codes are then organized into taxonomies or classifications.
So then if we want to find all patients with type 2 diabetes mellitus, we can follow the taxonomy and accumulate that. And building these taxonomies of standardized codes in an ontology is a very nuanced kind of thing. There's lessons learned over the years. The science of data science has developed a lot of best practices in ontology and ontology development, and then researchers need help applying these ontologies to their data collection and analysis.
And this is Dr. Hogan's specific area of expertise, resulting in many data standardization successes over his career.
One project is APRICOT, which stands for Advancing Prevention Research in Cancer Through Ontology Tools. The overall goal of that study is to advance the field of behavior change research to help ensure that the results of one behavior change study can be reliably compared to the results of another study. That's hard to do in the current state because it's hard to tell whether two studies measured the same thoughts, ideas, attitudes, and motivations of the people being studied.
So, an ontology helps
because it requires researchers to clearly define what they're measuring, and then they can compare definitions more easily and determine how well two data sets can be merged together to learn more from the combined data set than either individual one.
With the emergence of artificial intelligence, how does Dr. Hogan characterize the importance of AI, especially on the data science side?
AI is transforming just about everything in society, and healthcare is no exception. There's great potential for making healthcare more efficient, more cost-effective, and the real holy grail is to actually improve the outcomes of care through better disease diagnosis and prediction, and using AI to help us identify the best treatment for any given person.
It's not overstating it to say that artificial intelligence is creating
a revolution of sorts, and it's very important. So data science helping our researchers take advantage of these technologies and our healthcare system partners take advantage of these technologies all is essential to advancing our missions and remaining competitive.
Speaking of competition, is there any concern about the relationship between humanity and technology in artificial intelligence? Could concern of man versus machine become a reality?
There's absolutely that concern with the implementation of new information systems like electronic health records and informatics technologies. That are we going to depersonalize the relationship of the healthcare providers to their patients? And then there's concerns about ethical applications of AI, the ethical development of AI. If the data on which you're building your AI models is biased, then the AI models coming out of it might be biased.
For anyone listening, especially young people who may be considering a career in medical research, why might it be important to consider data science as a potential career path?
First of all, it's a great career. I have loved my time in data science. I love coming to work every day. It's an exciting, dynamic field. There's always new developments. You get to work with great people. And the other reason to go into it is because it's in demand. We need more data scientists, so you can really have an impact.
That's all the time we have today for this edition of CTSI Discovery Radio. As always, thanks to our guest for appearing on today's show, Dr. William Hogan from the MCW Data Science Institute. I hope you discovered something by listening to today's show. And I'm doubly hopeful you'll join us again next time. CTSI Discovery Radio airs the third Friday of every month. Make an appointment on your calendar and join us for each episode. On behalf of the Clinical and Translational Science Institute of Southeast Wisconsin, and all of our affiliate partners and members, I'm Brian Belmer, wishing you happier, healthier days ahead. For more information about research or to listen to the podcast of this or any of our shows on demand, please visit our website at ctsi.mcw.edu. CTSI Discovery Radio is written, produced, and hosted by Brian Belmer in collaboration with WMSE Radio. The CTSI and this program are under the interim direction of Dr. Julie Freed.